हेलो फ्रेंड्स, वेलकम बैक टू आवर चैनल नर्स अड्डा। आज हम आपके लिए लेकर आए हैं नॉर्सेट एग्ज़ाम का सैम्पल पेपर। जैसे कि आप लोगों को पता है, नॉर्सेट 11 का नोटिफिकेशन आउट हो चुका है। आपका एग्ज़ाम होने वाला है सितंबर को और इस बार बहुत सी सीट है, 2000 प्लस सीट है दोस्तों इस बार। तो हमें बिना टाइम गवाए अभी से तैयारी शुरू करनी है। तो आपके लिए लेकर आ चुके हैं हमारा सैम्पल पेपर 1 नॉर्सेट 11 का। ओके, तो बिना टाइम गवाए शुरू करते हैं आज का एग्ज़ाम। एम्स नॉर्सेट 2026 मॉक टेस्ट सेट 6। ओके, टोटल क्वेश्चन होने वाला है 100, टाइम 90 मिनट्स, मैक्सिमम मार्क्स 100। इंस्ट्रक्शन इज ईच क्वेश्चन कैरीज 1 मार्क। सेलेक्ट द मोस्ट अप्रोप्रिएट आंसर एंड अटेम्प्ट ऑल क्वेश्चंस। यहाँ पे नेगेटिव मार्क ऐड नहीं किया है, पर रियल एग्ज़ाम में नेगेटिव मार्क ऐड होता है। ओके, 1/3 होता है नेगेटिव मार्क और करेक्ट आंसर के लिए 1 मार्क मिलता है। ओके, नेक्स्ट नर्सिंग सब्जेक्ट से 60 क्वेश्चंस, जनरल नॉलेज 10, इंग्लिश 10, रीजनिंग 8, कंप्यूटर 6 एंड मैथमेटिक्स 6। ऐसे टोटल 100 क्वेश्चंस इस सैम्पल पेपर में इंक्लूड किया गया है। Let's start with question number 1. Section A, Nursing. Which finding is the earliest indicator of increased intracranial pressure? Your correct answer is option C, change in level of consciousness. Which electrolyte imbalance is most commonly associated with flattened T waves and prominent U waves on ECG? Your correct answer is option B, hypokalemia. Next, a patient develops inspiratory stridor immediately after thyroidectomy. What is the priority nursing action? Your correct answer is option C, assess airway and prepare for emergency airway management. Next, the most reliable indicator of adequate fluid resuscitation in a burn patient is? Your correct answer is option C, urine output. Next, which cranial nerve is assessed by asking the patient to shrug both shoulders against resistance? Your correct answer is option C, cranial nerve 11. Next question. A patient with chronic kidney disease is receiving erythropoietin. The primary purpose of this medication is to? Your correct answer is option B, increase RBC production or red blood cell production. Next, during suctioning of an endotracheal tube, the nurse should limit each suction attempt to how many seconds? Your correct answer is option C, 15 seconds. Which acid-base imbalance is commonly seen in prolonged vomiting? Your correct answer is option C, metabolic alkalosis. A nurse is assessing a patient with meningitis. Which finding requires immediate intervention? Your correct answer is option C, GCS score decreases from 15 to 12. Which insulin has the fastest onset of action? Your correct answer is option B, Lispro. A patient is receiving intravenous potassium chloride. Which nursing action is most appropriate? Your correct answer is option B. Dilute the medication before administration. Next one. Which heart sound is commonly associated with heart failure? Your correct answer is option B. S3. Next question. Which complication is most likely to occur after a femoral fracture? Your correct answer is option A. Fat embolism syndrome. A patient with chronic liver disease develops confusion and flapping tremors like asterisk 6. The nurse should suspect what? Your correct answer is option B. Hepatic encephalopathy. Next, which ECG finding is characteristic of hyperkalemia? Your correct answer is option B. Tall peaked T waves. A patient with acute pancreatitis should initially receive which diet? Your correct answer is option C. NPO, nothing by mouth. Which vitamin is routinely administered to newborns shortly after birth to prevent bleeding disorders? Your correct answer is option D. Vitamin K. Next question. Which laboratory value is the best indicator of kidney function? Your correct answer is option B. Serum creatinine. Which position should be given to an unconscious patient to maintain a patent airway? Your correct answer is option C. Lateral recovery position. Which microorganism is the most common cause of catheter associated urinary tract infection or COTI? Your correct answer is option B. E. coli. Next, a patient suddenly develops dyspnea, chest pain, and tachycardia on the second post-operative day. The nurse should suspect what? Your correct answer is option B. Pulmonary embolism. Which electrolyte imbalance is most commonly responsible for muscle weakness and paralytic ileus? Your correct answer is option B. Hypokalemia. A nurse is caring for a patient receiving digoxin. Which finding indicates possible digoxin toxicity? Your correct answer is option B. Blurred vision with yellow-green halos. Next one. Which laboratory test is most useful for monitored unfractionated heparin therapy? Your correct answer is option C. APTT. The earliest sign of hypovolemic shock is? Your correct answer is option B. Tachycardia. Which nursing intervention is the highest priority for a patient with suspected cervical spine injury? Your correct answer is option B. Immobilize the cervical spine. Next, Which electrolyte imbalance is commonly associated with positive trosis sign? Your correct answer is option B, hypocalcemia. Next question. A patient receiving oxygen through a simple face mask should receive a minimum oxygen flow rate of. Your correct answer is option C, 5 liters per minute. Next question. Which condition is the most common cause of acute pancreatitis? Your correct answer is option B, gallstones. Which nursing action helps to prevent ventilator associated pneumonia or VAP? Your correct answer is option B, elevate the head of the bed to 30 to 45 degree. Next question. A patient with diabetic ketoacidosis or DKA is admitted to the emergency department. Which intervention should be initiated first? Your correct answer is option B, start IV isotonic fluid. Next, which cardiac biomarker is the most specific for diagnosing myocardial infarction or MI? Your correct answer is option C, troponin I or TROP-I. A patient with syndrome of inappropriate antidiuretic hormone secretion or SIADH is expected to have. Your correct answer is option B, hyponatremia. Next question. Which assessment finding indicates improvement in a patient with acute heart failure? Your correct answer is option B, urine output of 60 ml per hour. Which isolation precaution is recommended for a patient with chickenpox or varicella virus? Your correct answer is option C, airborne and contact precautions. Next question. A nurse is caring for a patient after a lumbar puncture. Which instruction is most appropriate? Your correct answer is option B, keep the patient flat for several hours. Which acid-base imbalance is expected in a patient with prolonged hyperventilation? Your correct answer is option C, respiratory alkalosis. A patient receiving chemotherapy has an absolute neutrophil count or ANC count of 400 per millimeter cube. Which nursing action is the priority one? Your correct answer is option B, initiate neutropenic precautions. Next one, which vitamin deficiency is associated with bleeding gums and poor wound healing? Your correct answer is option B, vitamin C. Next question. A patient with acute ischemic stroke suddenly develops difficulty swallowing. What is the nurse's priority action? Your correct answer is option B, keep the patient NPO and notify the physician. A patient with severe heart injury suddenly develops unilateral dilated pupil and decreased level of consciousness. Which condition should the nurse suspect first? Your correct answer is option B, brain herniation. Which laboratory finding is most suggestive of bacterial infection? Your correct answer is option C, neutrophilia. Which nursing intervention is most effective in preventing DVT or deep vein thrombosis after surgery? Your correct answer is option B, encourage the early ambulation. A patient with hyperthyroidism is at greatest risk of developing which life-threatening complication? Your correct answer is option B, thyroid storm. Which electrolyte abnormality is most commonly seen in Addison's disease? Your correct answer is option B, hyponatremia and hyperkalemia. A patient receiving morphine becomes difficult to arouse with a respiratory rate of 8 per minute. What is the nurse's priority action? Your correct answer is option A, administer naloxone as prescribed. Which complication is most likely to occur during the first 24 hours after a major burn injury? Your correct answer is option B, hypovolemic shock. Which assessment finding is characteristic of left-sided heart failure? Your correct answer is option C, pulmonary crackles. Next question. A nurse is caring for a patient with COPD or chronic obstructive pulmonary disease. Which oxygen delivery method is preferred? Your correct answer is option B, nasal cannula at low flow 1 to 2 liter per minute. Next, a patient suddenly complains of severe chest pain radiating to the left arm with profuse sweating. Which nursing action should be performed first? Your correct answer is option B, assess vital signs and obtain a 12-lead ECG. Next question. A patient with a chest tube suddenly develops severe respiratory distress and the chest tube becomes disconnected from the drainage system. What should the nurse do first? Your correct answer is option B, place the end of the tube in a sterile water. Next question. Which laboratory test is the best indicator of long-term glycemic control in patients with diabetes mellitus? Your correct answer is option C, HbA1c. A patient receiving chemotherapy has a platelet count of 18,000 per millimeter cube. Which nursing intervention is the highest priority? Your correct answer is option C, implement bleeding precautions. Which electrolyte imbalance is most commonly associated with prolonged use of loop diuretics such as furosemide? Your correct answer is option B, hypokalemia. Next question. A patient with acute myocardial infarction develops sudden ventricular fibrillation. What is the priority intervention? Your correct answer is option B, immediate defibrillation. Next question. Which assessment finding is most characteristic of hypocalcemia? Your correct answer is option B, positive Troche's sign. A patient with chronic kidney disease is advised to restrict which electrolyte in the diet? Your correct answer is option B, potassium. A patient who underwent cataract surgery should be instructed to avoid what? Your correct answer is option B, bending forward and lifting heavy objects. Next question. Which nursing intervention is most effective in preventing VAP or ventilator associated pneumonia? Your correct answer is option B, elevate the head of the bed to 30 to 45 degrees. Next question. A nurse is caring for a patient with septic shock. Which parameter best indicates that tissue perfusion is improving? Your correct answer is option B, urine output greater than 0.5 ml per kg per hour. तो इसी के साथ हमारा नर्सिंग सेक्शन कंप्लीट होता है. नेक्स्ट सेक्शन है सेक्शन बी, जनरल नॉलेज. Which Indian state has the longest coastline? Your correct answer is option C, Gujarat. Next question. Which of the following is known as the Steel City of India? Your correct answer is option C, Jamshedpur. Next question. The Chipko movement is mainly associated with. Your correct answer is option B, forest conservation. Which vitamin is synthesized in the human skin on exposure to sunlight? Your correct answer is option C, vitamin D. Which planet is known as the morning star or evening star? Your correct answer is option B, Venus. Which Mughal emperor built the Buland Darwaza? Your correct answer is option C, Akbar. The SI unit of electric resistance is. Your correct answer is option C, ohm. Which of the following is the largest gland in the human body? Your correct answer is option C, liver. The red planet is. Your correct answer is option B, Mars. Which gas is the most abundant in Earth's atmosphere? Your correct answer is option C, nitrogen. Next section C is English. Choose the correctly spelled word. The correct option is option A, conscientious. Choose the correct synonym of meticulous. Your correct answer is option B, careful. Fill in the blanks. The doctor advised the patient dash complete bed rest. Your correct answer is option B, to take complete bed rest. Identify the error. Neither the nurse nor the doctor was available during the emergency. Your correct answer is option B, was available. Next question. Choose the synonym of scarce. Your correct answer is option B, plenty. Choose the correct passive voice. The nurse administered the injection. Your correct answer is option A. The injection was administered by the nurse. Fill in the blanks with the correct preposition. She is interested dash learning new medical procedures. Your correct answer is option C, in. She is interested in learning new medical procedures. Choose the correctly punctuated sentence. Your correct answer is option B. The patient said, I feel better now. Choose the correct word that is closest in meaning to reluctant. Your correct answer is option C, hesitant. Select the correct indirect speech. The patient said, I am feeling better today. Your correct answer is option C. The patient said that he was feeling better that day. Moving to the next section, section D, reasoning. Find the missing number in the series. Your correct answer is option C, 191. Explanation is, पैटर्न क्या यूज़ किया है इसमें, x इंटू 2 प्लस 1. ठीक है, तो ऐसे करने से हमें 191 आंसर मिल जाएगा. ठीक है. Moving to the next question. Question number 82. If nurse is coded as OVSTF, then doctor is coded as what? Your correct answer is option C, EPDUPSR. The explanation is, each letter is shifted one step forward. ठीक है. Next one. Ravi is facing east. He turns 90-degree clockwise, then 180-degree anti-clockwise, and finally 90-degree clockwise. Which direction is facing now? The answer is option C, east. Rationally, ईस्ट से पहले 90 डिग्री क्लॉकवाइज हुआ तो साउथ, देन 180 डिग्री एंटी क्लॉकवाइज हुआ तो नॉर्थ, देन फाइनली 90 डिग्री वापस क्लॉकवाइज घूमा तो ईस्ट। लेट्स कैलकुलेट केयरफुली। ईस्ट से पहले साउथ हुआ, साउथ से नॉर्थ हुआ, नॉर्थ से वापस ईस्ट। ठीक है, द आंसर इज ईस्ट। Pointing to a woman, Raj said, "She is the daughter of my mother's only son." The woman is Raj's what? Relationship जानना है इधर। Your correct answer is option B, daughter. Rationale is, my mother's only son refers to Raj himself. Therefore, the woman is Raj's daughter. Clear? Next one, find the odd one out. Your correct answer is option D, microscope. Explanation. The first three are commonly used in direct patient care, whereas a microscope is mainly a laboratory instrument. ठीक है? Next question. If dose is equal to 47 and care is 27, then the nurse is. Your correct answer is option D, 81. '87 question number. Statements are, all nurses are healthcare workers, some healthcare workers are researchers. Which conclusion definitely follows? Your correct answer is option C, all nurses are healthcare workers. Explanation is, only the first statement gives a definite conclusion. The second statement does not establish a direct relationship between nurses and researchers. Rearrange the following words to form a meaningful sentence. Your correct answer is option A, 2, 3, 4, 1. The sentence is, nurses care for patients. Next section is section E, computer. Which of the following is an example of system software? Your correct answer is option C, Windows 11. Which keyboard shortcut is used to paste copied content? Your correct answer is option C, Ctrl plus V. Which device is used to convert a hard copy document into a digital format? Your correct answer is option B, scanner. What does the abbreviation URL stand for? Your correct answer is option A, Uniform Resource Locator. Which of the following is an example of cloud storage? Your correct answer is option B, Google Drive. Which of the following file extensions is used for Microsoft Excel workbooks? Your correct answer is option C, .xlsx. Section F is mathematics. Question number 95. A medicine cost rupees 720 after 10% discount. What was its market price? Your correct answer is option B, 800 rupees. Exam tip is, whenever a discount question appears, then the selling price is equal to market price minus discount. Next question. The average of 5 numbers is 36. If 4 of the numbers are 30, 34, 38 and 42, the fifth number is what? Your correct answer is option B, 36. Explanation is, Average is equal to total sum divided by number of values. Total is 36 into 5. ठीक है. Sum of numbers are 144. Then the fifth number is 180 minus 144 is equal to 36. A train travels at a speed of 72 km per hour. How much distance will it cover in 25 minutes? यहाँ पे एक इक्वेशन यूज़ करना पड़ेगा आप लोगों को. The answer is option C, 30 km. Explanation is distance is equal to speed into time. Step 1, convert time into hours. 25 मिनट को आवर्स में कन्वर्ट करेंगे तो 5/12 आवर मिलेगा हमें. देन सेलेक्ट द फॉर्मूला. डिस्टेंस इज इक्वल टू स्पीड इंटू टाइम. स्पीड है हमारे पास, टाइम भी है, तो ऐसे हमें 30 किलोमीटर आंसर मिल जाएगा. नेक्स्ट, द रेशियो ऑफ बॉयज़ टू गर्ल्स इन ए क्लास इज 5:7. इफ़ देयर आर 60 स्टूडेंट्स इन ए टोटल, हाउ मेनी गर्ल्स आर देयर? द करेक्ट आंसर इज ऑप्शन सी, 35. रेशियो क्वेश्चन को सोल्व करते वक्त पहले रेशियो के टोटल पार्ट्स निकालो, फिर एक पार्ट की वैल्यू फाइंड करो. इससे कैलकुलेशन फास्ट और एक्यूरेट होती है. यह है आज का आपका एग्जाम टिप. ठीक है. नेक्स्ट, व्हाट इज 50% ऑफ 640? योर करेक्ट आंसर इज ऑप्शन बी, 96. एक्सप्लेनेशन इज दिस. 15% को हम 10% प्लस 5% ऐसे भी लिख सकते हैं. देन 10% ऑफ 640 is 64 and 5% of 640 is 32. Now add them. The answer is 96. Our last question is, a nurse has 240 ml of IV fluid to be infused over 4 hours. What should be the infusion rate in ml per hour? Your correct answer is option A, 60 ml per hour. Explanation is infusion rate is equal to total volume divided by time. Here volume is 240 and time is 4. Then the answer is 60 ml per hour. तो इसी के साथ हमारा क्वेश्चन कंप्लीट होता है. कैसे लगा आज का हमारा सैम्पल पेपर? अगर वीडियो थोड़ी सी भी हेल्पफुल लगी तो चैनल को सब्सक्राइब करिए, लाइक करिए और कमेंट करिए अपना पूरा स्कोर. ठीक है. सो कीप प्रैक्टिसिंग, स्टे कंसिस्टेंट, क्रैक एम्स नॉर्सेट 11 2026. तो मिलते हैं नेक्स्ट मॉक टेस्ट के साथ. थैंक यू फॉर वॉचिंग द होल वीडियो.